So our speaker is an independent writer and researcher. She holds an MBA from Dartmouth College. She spent 25 years of her professional career in the healthcare technology, medical device, and pharmaceutical R&D industries, both in the US and in Europe. She co-owned and managed several contract research organizations with scientists from the University of Rochester Medical Center. These companies perform clinical trials for over 60 pharmaceutical clients worldwide, interacting with the FDA, EMA, and Japanese FDA regulators. She has retired from the pharma industry and currently writes an independent Substack publication, Due Diligence and Art, which is read by subscribers in 190 countries. So please join me in welcoming Sasha Latipova.
Thank you. Well, thank you very much, and thank you for coming on Sunday morning to hear me speak. And my topic today is pandemic preparedness racket. It's, well, my favorite topic. And before I start my presentation, let me give you a warning. All unpopular opinions are my own, and I have a lot of them, so don't throw chairs at me. First, let's talk about narratives of invisible threats that are being used to control people. Just like, when you were little kids, you loved telling each other scary stories. Well, I did anyway. And they're fascinating. We as humans, we crave good narratives. And in fact, we crave actually imaginative narratives. And this is being used and abused by those in power, in control, to control the people. You probably have heard many stories about, especially from the likes of Yuval Harari, WEF, or even the alternative space. People are saying there is nanotechnology that is going to control you remotely, control your mind remotely. I can assure you, humans are not biologically hackable. Nobody can remotely control an unwilling individual. What is happening, however, humans are programmable by words alone. It's those words that are being fed to you by propaganda machine with variety of incentives, carrots and sticks. You're a good boy if you're repeating them, and you're a very bad girl if you are saying something against it. And you may have consequences, such as you can lose your license and be subject to lawfare and prosecution if you do that, or you will be censored on social media. I had my PayPal account banned for several years, all my social media banned for several years. So this is very, very important to those in control for you to repeat the words that they want you to repeat. And these tales, usually the tales of invisible global threats, are used for population control purposes, such as, for example, and they're typically invisible or very remote, so nobody can verify directly, such as the CO2 increasing, the climate change, systemic racism, viral pandemics, of course, aliens, or even sentient AI. Those are all catastrophes that we must be prepared, and especially spend gazillion of taxpayer dollars to prepare for. What I advise people to do to counter this is a very simple technique. Never repeat the words of others as they're given to you. If you disagree with something that you hear, put it in your own words. You will understand better why you're disagreeing with it. And especially if you agree with something, don't repeat it. Put it into your own words, because then you're engaging your conscious operator instead of being on autopilot like we normally are. We normally speak completely on autopilot. We don't need to think about the words that we're saying. So that's a very simple practice of mindless, mindless repeating of words is really dangerous. Mindful conversion of the narrative into your own language is very, very important. Now, let's think about one particular word that we're going to discuss here, the word that's used for propaganda very, very widely, which is pandemic. What comes to mind when you hear this word? Well, we're all aware audience here, but let's think about the so-called normies. What do they think about it? Well, that's how my kids talk. I learned from my children. And, so what happens? Well, they immediately panic, right? And that's what it is designed for. So let's look at a little clip. I made a 1-minute clip comparing the Pentagon Operation Warp Speed press conference from March 5th, 2020, to the movie Outbreak from 1995, which most of you probably have seen.
Did they actually get samples of coronavirus from someone who was infected? How did they do this?
Well,
Happy to. So our scientists are doing a number of things right now. There has been receipt of the virus in one of our laboratories, and they're currently culturing, growing that virus so that we can have stocks available for a number of things to test products with.
and the laboratory that received the samples that Colonel Sammons Jackson is talking about is the U.S. Army Medical Research Institute of Infectious Diseases at Fort Detrick. But if you think of the movie Outbreak and the suits that they wore and the highly contagious environment without...
In a remote African jungle, a small monkey is captured. Bound for a pet store in America, the animal carries a deadly virus.
Your town is being quarantined.
We got 19 dead. We got 100 more infected. It's spreading like a brush fire. What are you talking about? If one of them's got it, then 10 of them have got it now. And if one of them gets out of Cedar Creek, we have a very interesting problem.
If that bug gets out of there, 260 million Americans will be dead or
The most optimistic projection for the spread of the virus is this: 24 hours, 36 hours, 48 hours.
The people are dying and are going to continue to die unless we find this monkey.
Call that number!
The movie certainly.
All right, so that was fun, right? So does this look familiar? Of course it looks familiar. So did Hollywood write the pandemic script in 1995 for COVID? Right. Even this cast of characters at the DoD Operation Warp Speed conference looks identical to the main characters in the movie. A white woman, an African-American man in charge, a few other men in charge. The costumes that they wear, all this ridiculous spacesuit grab, the tanks and helicopters. They're chasing one monkey. All of this looks ridiculous right now. But in the middle of the pandemic, how much fear, how much propaganda was pushed on us to act as they wanted everyone to act. So this is what we need to keep in mind. All of this is a fairy tale of global pandemics. They actually don't exist, and let me discuss and give you some data here.
Did they actually?
Oops, okay, let's skip here. So this is actual data 20 years leading up to 2020 from WHO. This is all the events that they have recognized as epidemics or pandemics even. And as you can see, there are a number of different diseases that they list here, and they account for a whopping 0% of annual global mortality. Is this the existential threat that we're all told about and all these high-profile Hollywood movies need to be made about? Actually not, but it is a very profitable business. So sorry about the small text here, I'll read. This is a slide from BARDA, Biomedical Advanced Research Development Authority, which is a militarized arm of HHS. It's kind of a hybrid between Health and Human Services and the Department of Defense. And BARDA has been funding and building this octopus, which I'm going to describe here. So this is from their own slide. They're bragging that they've built all this ecosystem of MCM stakeholders, which stands for Medical Countermeasures Stakeholders. So they have this broad and very diverse ecosystem. It consists of course, BARDA in the middle. They have sponsors, which is White House and Congress and associated departments. They have partners, which include all executive branch agencies, such as Department of Defense, of course, DHS, DHHS, USDA, Veterans Administration, EPA, and, of course, foreign governments. So it expands beyond United States globally. They also have so-called performers. So these are the henchmen that they hire, which is pharmaceutical industry, academia, the media, of course, and even venture capital and private equity and banks, and of course foreign corporations. So as I said, this octopus spreads globally. It's the structure that is in place to bring us into the new world order with the one world government. So they already had built it over about 20 years period of time. So what starts as a ridiculous movie with Dustin Hoffman chasing monkey with the helicopters transforms into this giant structure. And the part of this that everybody overlooks is how much funding flows through this structure. In 2001, it was estimated that the biodefense spend was around $700 million a year. After 2020, it has well exceeded $1 trillion, because when you account for everything, the funding that flows for these medical countermeasures, which I'm going to discuss, including how much propaganda, censorship, suppression, judicial system takeover, all of this accounts for trillions of dollars of money spent on maintaining this operation. It's ongoing. Also, in addition to building the infrastructure and creating all these funding channels and organizations that are being funded by this, the major effort went into creation of the legal system, or we call it illegal system because it's hugely unconstitutional. But all these legislative acts, in a typical problem reaction solution manner, have been introduced and put on the books in the United States. So everything that I'm describing, all the awful criminality that's being conducted by the global public-private partnerships is actually fully legal, because they made sure that it is by introduction of these laws. I'm not going to cover everything, but the main piece of legislation we need to discuss here is this one, the PrEP Act. It was introduced on Christmas, on the weekend, in the middle of the night, on 2005, and was stuck into funding relief for Katrina hurricane, of course, as a hostage, so that the entire Congress votes for it. It was introduced by the Republicans in Congress. It was very significantly opposed by the Democrats. In fact, Senators Hillary Clinton, Joe Biden, Richard Byrd, and Ted Kennedy spoke against this law and called it hugely unconstitutional, the law that removes our rights as citizens to sue or seek redress if we're injured or even murdered by the actions of the government. So I agree with Senators Clinton and Biden on this completely. They were absolutely right. They were objecting to it. Of course, the next day, they turned around and voted yes for it. So this piece of law, which myself and my colleagues call license to kill, because it is, currently we have 9 different declarations extended by the Health and Human Services Department under this legislation. So what happens with this legislation, PrEP Act is kind of like an umbrella law that says if the government declares a state of emergency, typically has to do with health emergency, but can be others, if they declare a state of emergency by issuing a declaration under PrEP Act, then all the actions subsequent to that are actions or products that are being distributed to the public as a countermeasure to this emergency, and actions of anybody in the private sector who is working on this, they have full liability immunity shield from the United States government, regardless how much damage it causes, how many injuries, and how many deaths they cause. So this is the law that is still in place right now, and that's why we have no justice and no accountability for COVID. Now, in addition to COVID, let me point out that immediately after the PrEP Act was introduced, it started being used as a laundromat, obviously, because since 2008, and actually there were earlier declarations, but now we have these 9. Since 2008, we had declarations for anthrax pandemic, also smallpox pandemic. That's the longest running one. So it started in 2008 and will continue until 2032. So do we have an existential crisis of a smallpox in the United States, whether natural or gain of function? No. So obviously, these declarations have nothing to do with reality. They're simply a legal window that opens for pharmaceutical companies, cronies of the Congress people, to produce unregulated, liability-free products and sell them to the US government at obscene prices in no-bid contracts. And then everyone lines their pockets with it. So this is how this law was used until 2020, as basically as a laundromat and a way of siphoning taxpayers' monies into things that nobody needs. But in 2020, they deployed it in mass on the population. So we currently have COVID emergency ongoing. Despite what Trump administration is saying, despite what RFK Jr., my friend, is saying, COVID is not over. This declaration is still open, and it's going to continue. So RFK Jr.'s predecessor, Javier Becerra, extended it until December 31st, 2029. I personally spoke with RFK Jr. about it. He knows that he has the power to terminate this by writing a 2-sentence memo into a Federal Register. For some reason he won't, or he's not allowed to. I don't know. So that part I don't know. But that's what I would like you to understand. When Maha tells you it's over, we're in the golden age, everything is wonderful now. No, it's not. We still are under the same exact framework we were back in 2020. Now, why February 4th date was so important? So actually, notice that this PrEP Act declaration started on February 4th, 2020. It was actually announced in March, but then backdated to February 4th. And we didn't know why until I received this tape from a whistleblower inside AstraZeneca. And so this person recorded a 6-minute conversation on Zoom between AstraZeneca executives. Well, they were celebrating the approval of their monoclonal antibody in the United States. If you remember, AstraZeneca vaccine wasn't approved in the United States, but monoclonal antibody was, so they're all happy at the end of 2020 celebrating this. And in this conversation, Mark Esser, Vice President for monoclonal antibodies, recounts how they were approached in 2017 by the Department of Defense, specifically this person, Colonel Matthew Hepburn, who was later on a high-profile manager on Operation Warp Speed, and was never questioned by Congress. He's the first person to question, not Fauci, him, but he's not interesting to Congress. And so he currently teaches at, I think, Georgetown. I may be wrong. But so anyway, this person approached pharmaceutical companies, built the consortium, part of that octopus that says performers. So that was his job. And told them, the program is, we, the DoD, will identify pandemic potential viruses because we have a crystal ball. And you, the pharma, will be making vaccines and therapeutics for them within 60 days. To which Mark Esser said, my first reaction was it's science fiction. That's correct reaction. It is science fiction. You can't make products in 60 days. And also, there's no technology in the world that can identify a pandemic potential virus from a computer model. Okay, but yet, this is what the Department of Defense was fraudulently inducing pharmaceutical consortium to do. They all joined because money is wonderful from the government, and for several years they had to do nothing, really, just play science with the money that they were given. And let's play just a second. So then Mark Esser says this.
So in January, we were all anxiously following emerging news coming out of China of a new disease. And it wasn't a surprise to me that when I got a call on February 4th from the Defense Department here in the U.S. saying that the newly discovered SARS-2 virus posed a national security threat.
So that's the smoking gun. The smoking gun is that the pharma consortium was told on February 4th that COVID virus was a national security threat. And as you've heard before, the DoD itself has not received the virus from one monkey or one pangolin or whatever. It was from the computer, it wasn't from any monkeys. So they didn't receive the virus until a month later, March 5th, 2020. So how and who made the decision that this is a national security threat on February 4th? When you remember, there was nothing going on. There was no real sickness. Nobody died in the US. There were rumors of some deaths in China, but there was no impact. Nothing was going on. So why is this a national security threat? This is very important. This information is still classified. We still don't know who made the decision, based on what, who gave orders to Matthew Hepburn to call pharma companies and tell them that. But that's why the PrEP Act declaration was backdated to February 4th, because that's when that direction to switch to COVID products came from the Department of Defense to the pharmaceutical consortium.
So in January,
Oops, sorry. And the important piece of information came also from my colleague Debbie Lerman, who found this document. This is an org chart from, very confusing as all the government org charts are. I'll explain in a little bit. So this comes from the Pandemic Crisis Action Plan, so-called adapted, which was adapted literally months before they pulled off the February 4th operation. Prior to this adaptation by unknown persons for unknown reasons with unknown process, the document looked completely differently, and the org chart also looked very differently. The previous document, which was Pandemic Crisis Action Plan for the US government, put HHS in charge of any public health responses and had normal things, normal from public health perspective things, such as masking is not useful, we don't lock down anything, people live normal lives, we tell everybody not to panic, and wash your hands and stay home if you're sick. Those were the premises of normal public health management of some sort of epidemic or respiratory disease season. Now, in the months preceding 2020, somebody adapted it. And there are a couple of interesting things that happened here. First of all, the policy decision-making is all in the National Security Council. And National Security Council is an advisory body to the US president that consists only of heads of military and intelligence agencies, and no health representatives are ever on the Security Council because they don't have high enough security clearance. At that time, it was Trump, and also Kash Patel was a National Security Council. So he's another person to ask what happened and who made those decisions, and why are they still classified. Obviously, the HHS is involved here, but notice in the green, they're just in charge of operations. In fact, during the height of the COVID propaganda, CDC wasn't allowed to even conduct their own press conferences. So don't yell at Fauci. Yes, he should be on trial for crimes that he committed, but he wasn't in charge of this operation. National Security Council was, and he wasn't part of it. Also notice that the White House task force is floating up in space somewhere on a space station and not responsible for anything, attached to anything, nobody reports to it. Why? Because it was made for show, to fool the public. Whoever was on that White House task force, they didn't know who was making decisions, how it was happening. The only person in charge there was Deborah Birx. Again, not Fauci. Deborah Birx from State Department was a liaison between White House task force and the National Security Council. That's how things were decided and done. Nothing else matters on this graph. So again, don't yell at Fauci. Now, what happened here? Like, the timelines are very important for any criminal investigation, right? So let's look at the timeline. This is data for COVID new cases and COVID new deaths from our world in data, just graphed for the first year or so. And as you can see, when the February 4th phone call came out from the DoD to the pharmaceutical consortium, absolutely nothing was happening, as I said. When months later, March 5th, the DoD does the first Operation Warp Speed press conference, announces that they have a virus, they're growing it for stock, whatever that is. Right after that, things start happening. So how is this government response to a pandemic instead of the opposite, which is the government actions caused all this? And they were announced on February 4th to pharmaceutical companies and on March 5th to the public. So they announced the deployment of weapons and countermeasures, and they proceeded to deploy them. And all of this and all subsequent misery, death, injury are 100% attributable to the government actions. The government actions on how this pandemic was staged and faked was hospital murder protocols, which many of you are probably familiar. Some of you unfortunately lost loved ones to. My mother-in-law was almost murdered with this protocol, so I know exactly how it's conducted, who and how everything was done. We managed to rescue her, thank God. There was fraud on death certificates. Plainly, any homicide victims, traffic accident victims would just PCR afterwards, or just basically marked as COVID to get additional funding. Poison injections and drugs were distributed under false labels of vaccines and therapeutics. And of course, a lot of money was spent on propaganda, fear, censorship, suppression of dissent. Liability shield was provided for murderers for hire, which is the healthcare system, by the PrEP Act. In fact, the PrEP Act says that it is not a willful misconduct if you kill somebody as long as you report it to us and as long as you followed our orders. Exactly the same thing as the military in the combat situations. They're not held accountable if they follow the orders. Now, let's discuss medical countermeasures, which is the weapons that are deployed through this method. Medical countermeasures countermeasure is a military term. Countermeasure can be anything. It's a very vague term, specifically on purpose not defined. And for example, the lock on the door can be a countermeasure from breaking in. You can use all sorts of things. You can have a cooking knife, or you can use it, if somebody is attacking you, you can use it as a countermeasure. So that's how it is. That's how it's defined in law. It's just based on use. It's not what it actually is. It's how it's used. This is a slide that comes directly from the FDA, from their lawyers. I have their entire slide deck explaining countermeasures to their own staff. And here it says this is the process, entire process for issuing or deploying countermeasures on the market. By the way, the EUA, Emergency Use Authorization, in law, belongs only to countermeasures. There is no other way. There is no way to EUA a normal drug, or that's purpose of it, which is medical treatment. You cannot EUA it. It only belongs to countermeasures. That's another point of confusion nobody understands. When it says EUA, it's on the countermeasure pathway, and then all of these laws apply, and I'm going to explain how. So what happens in this process? First of all, HHS secretary or DOD secretary or DHS secretary can issue a declaration of an emergency. In this case, we're dealing with public health emergency issued by HHS. At the time, it was Alex Azar under Trump 1.0. So he issued emergency declaration in March, backdated to February 4th, 2020. After that, HHS Secretary Alex Azar asks FDA Commissioner I think it was Scott Gottlieb at the time, to issue EUA. So actually, EUA issuance, it didn't happen in December 2020. It happened simultaneously, and that's how the law treats it again. Once the HHS Secretary makes declaration in February, that issues the EUA. So now you have a blanket EUA open for any countermeasures that are going to go on the market for this. So it's like the window opens, they don't care what it is, it's just going to be issued as a paperwork. And then FDA can issue EUA specific to a specific product whenever they feel like it afterwards. So but they have the authorization from the government. And the termination of all of this can only happen when, again, HHS Secretary either asks FDA to remove a specific EUA authorization for a specific product, or HHS Secretary terminates the entire thing by terminating that declaration that was made in February 4th, 2020. As I said, RFK Jr. fully knows that he can do it. I've published open letter to him discussing it, and we discussed it on the phone. Notice the important thing, nowhere here it says, and then clinical trials, and then we issue EUA. No, because clinical trials are entirely inapplicable to EUAs. You can never EUA a clinical trial an EUA product. Why? Because the law deems them non-investigational. Non-investigational chemical substances cannot be clinical trial because clinical trial is an investigation in humans. So you cannot do an investigation with a non-investigational chemical substance. That's one thing. Another thing the law says, and I have direct citation from it, that countermeasures shall not be deemed adulterated or misbranded. And do you know that the entire purpose of the FDA and the reason why it was set up I believe in the 30s or 40s, is to prevent this from happening, to prevent adulterated and misbranded product in interstate commerce. That's their sole mandate. So here we have a law that says none of what FDA does is applicable to this. So FDA stand down. You are only a pass-through entity to shovel the paperwork and to pretend, and the most important part is to pretend to the consumers that this is a medical product. That's the FDA's role here. They're playing a theater. The theater is called, we're regulating this. Okay, but it's a lie. It's a complete lie. Legally, there's no regulation. There's no enforcement of any pharmaceutical law to the EUA countermeasures. And another thing, what misbranded means, it means that everyone is allowed to lie about it. Everyone, meaning everyone who is following HHS protocols and directions, following the orders. If you're following the orders of HHS or DOD, you can lie about countermeasures and face no liability. That's how the law is written. So, again, when you hear from Health Freedom that we just need more gold standard science, laugh at them, okay? This is laughable. Science is not applicable here at all and never was. There is no gold standard science. You can collect gazillion piles of gold standard science research, and it does not compel FDA to remove these products from the market because they don't, the law says they can continue this as long as they wish to. So we do not need any more gold standard science. We need to treat it as what it is. It's a matter of law, criminality, and pandemic racketeering by public-private partnerships. This is direct citation from the law, which I'm going to skip. I already discussed it. And so when I realized that this was a military operation, it was because of Brooke Jackson's case. I don't know if you've heard about it. She was a whistleblower working on Pfizer clinical trials. She was fired because she was bringing objections to how the trial was run. She found numerous examples of fraud. Not proper informed consent for the participants and so forth. And she complained all the way up to the FDA, and on the same day, she was fired from her job. So she's been suing. As part of that lawsuit, Pfizer was forced to produce their DoD contract. So later on, we found that it was FOIA'd by this organization, KEI Online, and the slides will be available. You will be able to check this with this link. This is just a small screenshot from that. There are maybe 400 contracts here. All of them, notice, come from DoD. DoD is the contracting entity. All the money, like all these $50 billion that were spent within first, by the end of first 2 years, by the end of 21, they spent about $50 billion through these no-bid contracts. All other transaction authorities, so very, very non-transparent and no accountability, really. It all went through ATI, Advanced Technologies International, which is a major project manager for the DoD. They manage all sorts of weapons buying contracts, such as like regular weapons or aircraft carriers, jet fighters, and so forth. So all of this went through this manager, obviously took a cut, and through the DoD to all these pharmaceutical companies, medical device companies, healthcare, all sorts of things. And when Pfizer produced this contract, this military contract, then I started reading them, and turns out these contracts are written for the scope of the purchasing is large-scale demonstrations and prototype, meaning fakes, no accountability. And Pfizer was defending themselves essentially with these contracts, saying that we didn't defraud the government, we delivered the fraud that the government ordered, which is prototypes and demonstrations. What are you asking us? Brooke Jackson, go away. And so, the court dismissed her multiple times. The case was dismissed because the theory under which they were suing the government is False Claims Act. False Claims Act says the supplier defrauded the government on the government contract. It turns out they didn't because the government is in on it. That's what the government ordered. Later on, I collaborated with another colleague, Debbie Lerman. She's a journalist. She's written for Brownstone pretty extensively. She now writes her Substack as well. And we've compiled the dossier, COVID dossier. We published it first on February 4th this year as an anniversary, 5-year anniversary of that announcement. But we also updated it with a lot of readers from all over the world supplied their information to this dossier, and we also updated it and republished in March. So this dossier, you can find it on my Substack and on Debbie's Substack. It's basically just a listing of all the publicly available materials, key people, key announcement dates, showing exactly the same pattern all over the world. The same thing that happened here in the United States happened in practically every Western country that was following these orders from these global octopus that I was showing you, right? Because it has foreign governments, it has foreign corporations. So it was conducted all over the world. And we have all the key materials. And if people want to investigate, this is the resource to go to and start your investigation for your specific country or for whatever interests you. Another key event that corroborated everything that I'm saying today is the case that wasn't advertised very widely, but it happened here in Utah. So if any of you are familiar with the case of Dr. Kirk Moore, he's a surgeon who was giving people fake vaccine cards and throwing away the vials because people had no choice, were facing termination at work and their children couldn't go to school. So people were desperate coming to him. He saved a lot of lives. He's a hero and he should be celebrated widely. He's my subscriber, yes. We need more doctors like this that don't want to follow military orders to kill. Okay, they want to serve their patients and their community. And so he's one of my subscribers. He was zealously prosecuted by the state, by the federal government. He was facing 35 years in jail. He spent about $1 million defending himself. He came to me and my colleague, Catherine Watt, couple of times. We provided the information about the military operation. We helped them draft some deposition questions. They were able to introduce this into the evidence in court. Yeah, it was the first case where this evidence actually was, like the contracts that I was showing you were introduced in court. And what happened? So the Department of Justice, with Pam Bondi in charge, was still prosecuting him well into the Trump administration. In July of this year, there was a week of trial here in Salt Lake City. There was a week of trial. On Thursday of that week, there were two witnesses testifying for the state, Chris Duggar, ex-CDC, and Gary Disbrow from BARDA. And these two gentlemen, I've also published on this, on the transcript from this court, they said things in court such as, I will say our original plan, which never survives encounter with the enemy, wasn't expecting a 25% decline of vaccinations in the United States. The soldier can't operate in the field if they run out of bullets, referring to vaccines. Disbrow said that the distribution plan was developed by the Department of Defense as well as Palantir. Palantir was in charge of the distribution. Peter Thiel's company, the big brother that they're building to surveil us all with digital IDs and all that we discussed extensively at this conference. And that the DoD had personnel in all vaccine manufacturing facilities, which I can independently corroborate because I also spoke with the whistleblower from Moderna plant in Boston who said, yes, we have an office of DARPA inside and you can only access it with high security clearance. So this testimony, on Friday of that week, the government tried to call them back and tried to have them recant or change the language, but it didn't go very well. And on Saturday, Pam Bondi dropped the case. So this is such a hot potato, and the government wants you to not think about it at all and not talk about it at all and pretend like COVID is over, we're moving on, and it was just a mismanaged public health crisis. This is how important it is to them. They will drop a case like this in a day, essentially. So now I'm often asked, like, you're so, you give me PTSD. I went on Dr. Drew's show a couple of times, and every time I go there, he's like, you're traumatizing me. So what can we do? Can you give us some solution? Can you offer something? What can we do? So besides the strategies we discussed here for becoming more independent, sufficient, and building local communities, what I could say is we need to advocate. I do believe there are good people at HHS. I do believe we can achieve something, even despite all odds and despite the current administration being so heavily controlled by corporate interests. But we could, if HHS were acting in good faith and really wanted to restore public trust, what could they do? Well, first of all, they could reclassify mRNA and DNA vaccines into gene therapies, such as they were classified for about 20 years before suddenly they became vaccines for unknown reasons. And then apply the regulatory frameworks that they already have for gene therapies to those products. And that would keep them very safely off the market, because there is no way in the world to ever make this thing safe or effective, according to pharmaceutical regulations. They also must disclose all known risks to the public. So the presentation I just did to you should be given to everyone who receives countermeasures, essentially, but I can summarize it here. This is actually required by the PrEP Act itself. The Congress was very explicit, saying that if you are deploying countermeasures, you must give to the recipient all known risks about this product. And the known risks of countermeasures include that it is a non-investigational EUA countermeasure, which is a completely different legal status from a normal medical product. So it's not a medical product. That's number one disclosure you need to give. It's not a medical product, it's an EUA countermeasure, totally different thing. It only can exist when, first of all, it cannot be mandated ever. That's also very explicit. And can only exist when United States government believes the country was attacked with chemical, biological, radiological, or nuclear weapons. And as I've shown you the existing declarations, they don't believe that, but this is how the law is written. They also must revoke biologics license applications for all Pfizer and Moderna vaccines and other products that they have authorized the same way, because they're legal fakes. You cannot have a biologics license application, which is an investigational approval, for a non-investigational EUA countermeasure. So that's where FDA's role is to lie about this one thing. That's what they've done this entire time, these 5 years, that's what they're doing. They're producing a legal fake so that everyone goes and gets it mandated, and the government pays the money to mandate. Also, the recipients must receive the disclosure that countermeasures are legally allowed to be adulterated and misbranded, and covered persons, those who follow HHS orders, are allowed to lie about the shots, their safety, efficacy, and ingredients. And also, people need to understand that in case of death or injury because of these countermeasures, the only available recourse to them is Countermeasures Injury Compensation Program. To date, this program paid out around 0.2% of claims that were submitted, so nothing, and they're not intending to pay anything. And also, people waive their constitutional rights if they receive a countermeasure. So those are the basic disclosures that I highly would like HHS to force onto the labels of these products and into the patient information sheets and the provider information sheets. And imagine if those normies who all are fearful of pandemics and run and do whatever government tells them to do, or the doctors that are injecting their patients, or the pharmacists, if they read this, do you think we would unite our society somehow? Yes, we would. We would heal immediately and unite. because this is the government doing it to us. It's not Democrats versus Republicans. It's not, China versus United States. It's what's going on. And that disclosure must be there because the PrEP Act requires it. Also, of course, we must work to repeal the PrEP Act. All of this is nonsense. It's complete nonsense, as I said. It's just a laundromat. Normally, idling, it's a laundromat. When it's deployed in mass, like it was in 2020, it's a disaster. So this needs to be repealed. There is effort right now, I know, by Thomas Massie in Congress, who's the only person who's doing anything. Yeah. He has a bill introduced to repeal the PrEP Act. We should support him on this. And in general, we should be very vocal about this whole matter. This needs to go. Also, for the resources, I highly recommend my friend Catherine Watt. She writes a Substack called Bailiwick News. This is the #1 resource for law in the world. I don't know of any other. We are both expert witnesses in the Dutch case, which has been ongoing against Dutch state officials. Mark Rutte, who was the prime minister but now Secretary General of NATO, he's one of the defendants. Albert Bourla, Bill Gates, and others. So she's written the St. Benedict memo. It's available on her Substack as an expert witness testimony for this case. And I'm just going to summarize it in a couple of bullet points. There are no defined material substances that comprise COVID-19 vaccines. There is no definition of it. Any material can be in it. I've shown you because of the law says that it can be adulterated, means any substance can be in it. It doesn't have to comply with any label. There is no composition of matter-based definition of a vaccine and has never been. And Catherine traced that law to 1700s. There's never been a definition of a vaccine based on the material. It's undefined. It's only based on use. It's always been a countermeasure. It's always been a poison because they don't define what it is. It's only defined based on use. So since 1970s, when FDA took over vaccine regulation, it's vaccine when we say so. That's how they switched from gene therapy to vaccine very easily, because the law already allows them to do it. That's another power that needs to be removed from them. You can't just say, oh, this dangerous drug was dangerous drug yesterday, but today we declare it vaccine, and so no regulations apply to it. Also, when we say it's vaccine, no regulations or liability apply. That needs to go. That's the 1984 law, right? So that needs to be removed as well. No vaccine has ever been regulated for safety, efficacy, or manufacturing compliance. Again, tracing back to 1700s, there's never been real regulation for safety, efficacy, or manufacturing compliance. And therefore, all vaccines are and have always been intentional and regulated poisons. And therefore, they're indistinguishable from weapons. Legally, materially, forensically, whichever way you look at it, they're indistinguishable from weapons. You can learn more about all of this. I've covered it in about 45 minutes, but I have over 600 articles on these topics available with a lot of materials on my Substack. It's called Due Diligence and Art. And all my new articles are free to everyone for 2 months, and then they go into archive, and archive is available for paid subscribers. Very much appreciate paid subscribers. A lot of you are here. I know I've talked to a number of people. I really appreciate you. I like that you like my art. So thank you. And any questions? Yes, microphone.
Is that good? All right, make sure you talk into it like you mean it.
Okay. Well, I feel bad. I'm the first one. I have 4 questions,
Okay,
but I can't help myself here. You talked once about, and this was a great presentation. Unbelievable. You talked once about bags of COVID juice being delivered to a special building at Moderna by DOD people. Do you know what was in those?
Nobody knows what was in them. So that was the thing that, as I said, I've been talking to one whistleblower from Moderna, from manufacturing, and they were trying, early on I was looking into batch variability, and we were trying to identify that question, like what's in the especially toxic batches. So I found a couple of super toxic ones, and I gave him the numbers, and he tried to figure that out. It's not possible. There's no, and this is the person who works on the manufacturing floor. So this is a huge violation of a pharmaceutical law to begin with. People who are mixing things cannot not know what's in them, and that you can't not trace what's in them.
Interestingly, I heard Dr. Patrick Soon-Shiong talk about getting bags of COVID juice from abroad. You might want to talk to him if you haven't already.
They were flown, yes, they were flown into the U.S. from Europe. They were flown because Pfizer had facilities on both sides of the Atlantic, and typically they would, so that I know I got from leaked documents that, let's say, the substance would be coming from Rentschler, which is their German facility, to the U.S., and then they would also be sending bags to Germany. But where those bags originally came from and what's in them, nobody knows.
Unbelievable. And what do we know about the distribution plan that was planned by Palantir, and how does that link in with Real ID, the digital ID, and all that?
Yeah, so the distribution is a whole different topic. I also have written on it. It was handled completely, again, outside of a pharmaceutical law that exists in the U.S., because in the U.S., the pharmaceutical distribution is regulated by the states. So the FDA says, we feel that this is a safe and effective product. It goes into interstate commerce. From then on, healthcare is regulated largely by the states, and pharmacy distribution also regulated by the states, highly, highly regulated. It needs to go through civilian pharmacy distributors. In this case, they used civilian pharmacy distributors as military contractors, and they all had, and Palantir was tracking us, so they were not allowed to use their own systems that track pharmaceutical distribution and are compliant with the law. They were taken out of that system, given to Palantir as a black box to collect all the data, but that data is not available to anyone other than Palantir and, the Department of Defense.
So do they even have the data by lot number of who got which COVID shot, and that could be linked to your Real ID?
Oh, absolutely, yes.
Great. Okay. The BLAs, the biologic license agreements, I've studied those, and I think they're legal fakes because I saw one line in there under the children's or pediatric section. It said, this BLA is, quote, ready for approval in ages 16 and up. Is that why it's a legal fake, or are there other tells?
Ready for approval. Yeah, that's a very funny language.
Yeah.
That's a tell.
Okay. And then finally, and I'll get off the mic, can you explain the other transactional authority which allowed the mandates? Because I still don't totally understand that.
Other transactional authority is not linked to the mandates. Other transactional authority is a way for the government to purchase things without accountability that typically government contracts carry. So it's a way to hide a lot of things, hide intellectual property, don't disclose a lot of material things that they're supposed to for government contracting, and also do a no-bid contract. And typically, DoD uses that to buy weapons, and they justify it by saying, well, we don't want our enemies to know what kind of weapons we're buying. So this is what was used to purchase ostensibly civilian medicine.
Okay, thanks. Glad I asked. Thank you.
I want to ask, because county farm bureaus in Colorado support the inoculation of all the chickens with the mRNA varieties, and since eggs are in so much, what do you know about that and our animals, especially the cattle, and etc., okay, for the milk?
Yes, exactly. So I have written several articles. In fact, I also have written an article about maybe a year and a half ago for Weston Price specifically on this. I've written about mRNA vaccines in animals, and that's a disaster. It's a disaster. I am concerned about the food quality, but that's even secondary to the health of the animal. It's always secondary to the health of the animal. The mRNA in animals is just as destructive as it is in humans, and it causes the same type of diseases. I've written extensively. There was one mRNA vaccine approved already, I believe in 2016. It's called Sequivity. by Merck. It was approved for pigs. And I got the data sheets from the USDA, and I reviewed it, and I've written up, it's atrocious. So I don't know how anybody in their right mind, any farmer, can use these things on their animals, because with the security thing, they lose 30% of the herd right away, and then the rest of them get huge amount of illness. And of course, as it's usual with all these vaccine products, nobody ever studies them long term. So it's a short term, like maybe a week study, and even in a week, you can see how much damage it does. Animals dying and then getting all sorts of sickness. And they will get cancer. They will get turbo cancer. But if a cow or a pig gets cancer, well, guess what? They get slaughtered, and then they get shipped to another country. And then we were trying to introduce a food labeling bill, again, about maybe a year and a half ago here in Utah. In legislation, we were trying to argue for labeling if the animals were injected with mRNA, and we had a pharma lobby show up, you wouldn't believe, and they shut it down like in 5 minutes. And this is what's coming. So they're going to destroy the quality of the animals, the quality of food, the quality of milk, eggs, whatever. And we need to stop it, and we need to demand, the consumers need to demand labeling. I want to know if the animal was injected with mRNA. I don't want that junk.
So I second the First Lady. Thank you. You have a gift of taking very complicated information and distilling it, speaking quickly, clearly, and moving through, and you are the right person at the right time.
Thank you. Thank you.
And so much so that it makes me fear for your safety. And
it's okay. I don't fear for my safety. I'm here. I'm here now. I'm talking to you. What do I have to fear?
So I have, I guess, a two-part question, two different angles. One is, do you have any idea what they are holding over people who are clearly passionate, who we thought were on our side, RFK, maybe, I don't know about Trump, Kash Patel, Dan Bongino, people who really seem like they wanted to do something, and now they're not. And and the other part of that, do you have any idea how they're being controlled? And is there anything that we can do about it? I mean, obviously these people have been planning for a very long time. They have a lot of sophisticated apparati, that have been work in the works for decades. But there are also a lot of very smart, harmed people on our side. Michael Flynn is somebody who comes to mind. People in strategy, people who, is there anything that can be done on a very, very high level to help protect these people so that they can do what they need to do? So first is, do you know how they're controlling them? Is there anything we can do about it? And then the third, is there anything that anybody here can do to help? You mentioned Thomas Massey, Brownstone, all of us know people. We're fortunate enough to be from Kentucky and are friends with Thomas and Rand Paul and things, but clearly you know all of these people. Is there any vehicle that you want? Do you want to be on Tucker Carlson? Do you want access to somebody that you don't have access to? Is there anything anybody can do to help?
Thank you. Yeah, those are good questions. Well, let me tell you first, as far as, asking how are these people who we thought were on our side and now not doing what they were promising to do, how are they controlled? Well, I can't sit in their heads and I don't know their backgrounds. I don't know exactly how they're controlled, but my guess is what I can discern from publicly available information. Trump administration is heavily funded by pharma. And that's not, every administration is heavily funded by pharma. It's not unique to Trump, obviously. They funded Trump 1, Biden and Trump 2, Susie Wiles, Kelly Means. These are major pharma lobbyists. Kelly Means' father is Nelson Rockefeller's staffer, known globalist, writes, has a website writing about New World Order, global agenda. So what do you think Kelly Means is doing there? And of course, so the pharma lobby is a huge contributor funding Trump's entire operation, and they're profiting off of it. I also have written about it. So, for example, Trump just now made a deal with Pfizer. It's being advertised as if, I threatened them with tariffs and they caved in and they somehow, but as a result of this caving in, the Trump administration is allowing them to go sell drugs directly to the consumers. They're eliminating the pharmacy benefits managers, and I'm not crying tears over that, but they're eliminating the middleman and splitting the proceeds amongst themselves. So pharma gets a chunk, Trump family gets a chunk. Trump licensed their name to TrumpRx, so he's getting licensing revenues. Trump's son, Don Jr., is on BlinkRx, yet another layer of that distribution where he's getting the cut. Okay, so they're directly profiting. Howard Lutnick, his Commerce Secretary, is funding a vehicle to take BlinkRx and TrumpRx public so everyone can participate in that investment vehicle. And so that's one mechanism by which everyone is controlled. They're allowed to profit off of this. They're given position of power, and they're allowed to profit off of this. It's one very obvious mechanism of control. There may be others. Of course, Epstein files, we will all want to see them. And that may be another mechanism of control. So that's the thing. What we can do about it? Yes, I very much would like support efforts, any effort, going toward repealing the PrEP Act and providing the disclosure, as I've just discussed, because those are number one and number two step to reconciliation and accountability and justice. We can't just move on like Jay Bhattacharya wants us to just move on. Maybe somebody got hurt, maybe somebody didn't get hurt. It's time to move on from COVID. This is his opinion piece in Washington Post. So, and call them out when they're saying stuff like that. Don't just sit there cheering. Also, Maha propaganda wants you to, oh no, you're not supportive, you're criticizing RFK Jr., how could you do that, you're an enemy. No, I'm not an enemy. I am trying to keep him accountable to the promises that he made to us. And I don't care how he's controlled, I don't care what, yeah. And all of us must do it. Because if we're sitting and cheering to them saying nobody got hurt and it's time to move on, well, then we're part of the problem, we're not part of the solution. The solution is for everyone to be honest with each other, and that's what I'm asking everyone. Just asking how to repeal the PrEP Act. So there are a couple of ways. So Thomas Massey has a bill proposed, and which just says repeal. Well, I think he has some modifications to it, but literally you can just introduce a bill saying repeal PrEP Act, and that's enough. We can call on RFK Jr. That's my open letter. I published it on my Substack. I published it on Twitter. I wrote an open letter to RFK Jr., which explains, what he can do if we can't. Congress is not, willing to repeal the PrEP Act. He can remove those declarations by himself. That's the law says that he can, by just writing a memo to Federal Register saying, I no longer believe there are circumstances that justify this declaration. That's it. Also, the disclosures that I'm asking from the FDA can be now introduced at the state level. So I highly advise you guys, if you have legislators who are willing to consider this, and I'm perfectly happy to speak with them, explain this. There is a precedent now because several states, several blue states, have formed healthcare alliances to do their own vaccine policy, their own CDC recommendations, their own things. That sets the precedent that it's no longer a federal issue. You are asserting state rights. Well, let's assert the state rights here. The state rights can say that, okay, FDA can issue countermeasures, but if countermeasures arrive in our state, we are obligating all the healthcare providers to give out this information sheet to everyone. Just dear doctor letter, dear patient letter, that's it. And that's another mechanism by which we can prevent this. And this could be done also for animal health, for farmers. If a farmer is being forced by the health department or USDA to vaccinate their chickens or their cows with mRNA, they should also get this sheet. And the veterinarians should get that sheet. And then we'll see what happens. Because once people are given the truth, they usually act in the right way.
Thank you very much. You pointed out very clearly all the problems we have in our own government and our own healthcare system. I like to go with the global players and international. because the United Nations, through its WHO, the World Health Organization, has the 2024 amendments that automatically will take effect for its 150-plus member nations as of September 19th of this year. Fortunately, Robert F. Kennedy Jr. and Marco Rubio disavowed participating in the 2024 amendments, along with only 3 other member nations, which was Israel, Italy, and Austria, which means that the World Health Organization, as bad as we are in this country, the World Health Organization wants to take over the health of the world. And they could issue a pandemic, real or manufactured, anytime they wish. What is your comment on that?
Yeah, that's true, and this is what happened already in 2020 because they issued the so they call it Public Health Emergency of International Concern. It's pronounced fake.
But it's real. I mean, this has taken effect. I'm afraid to go to foreign travel because I may get stuck over there and be forced into that country's rules and regulations.
Right. So what people need to realize, WHO is not in charge of anything. It's a coordinating body because they do not have jurisdiction anywhere. The laws, international laws, are unenforceable because we don't have some sort of intergalactic committee coming in and enforcing it. The laws, they use WHO as a coordinating entity and as the entity to point finger at and to say, oh, you know, Tedros said there is a pandemic, we must do something. So, but all the actions and executive orders are coming from each government individually, in each country individually. They just use it as a, point the finger at the other guy type of thing. Now, of course, we should fight it, but what was evident by RFK Jr. saying we just don't going to follow WHO because of this, because WHO has no jurisdiction. They can't tell RFK Jr. or Trump or anyone here to enforce any law. And that's exactly what he did. He said, we're just not subject to it. Yeah.
If everybody in this room went to house.gov and senate.gov and got one more person to do the same and follow the directives of what Dr. Sasha will give us in terms of repealing the PrEP Act and et cetera, and what we can do in our states, we can make a difference because through the chapters, we can get our chapter to do the same thing. And we need to do this for like 2 months, okay? And you call every day or every other day or even once a week, and you say what we have a script for, basically, which is repeal the PrEP Act. They hear so much of it, we can make a difference, is all I'm saying. Okay,
exactly.
Will you make a plan of action so we can follow it on your Substack?
Yes, and I have published it, so you can see, actually, myself and my friend James Rogaski, who also writes a Substack, we've wrote series of articles exactly about this matter to repeal the PrEP Act and what you can do. You can sign, there's a petition you can sign, and what you can, like action steps for calling your legislators, explaining to them what's going on, asking them to couples either support the repeal of PrEP Act or support the initiative for properly labeling and disclosing the risks with the countermeasures to the public.
Will you put that and use that
Yes.
on your Substack
Yes.
as well?
Yes.
And then we'll do it with, hopefully with Weston A.
Yes, excellent, yeah.
Thank you, Sasha.
It's officially time, so if Sasha wants to stay and take a couple questions, that's up to her. But if the session is officially ended, so if you want to go and do your break and go see the exhibits, that's fine. But Dr. Sasha, if you want to continue questions, it's
Sure,
up to your
yeah,
discretion.
I'll continue questions, yeah.
Wonderful talk. I was just going to say to everybody.